from our analysis of our own data sets over millions of patients discharged from our ED practices across the country that if a patient is going to bounce back to the ED for a repeat visit after an initial discharge visit, more than 50% of those repeat visits happen within 7 to 10 days of the initial visit. So we have got to hustle. We've got a very small window of opportunity to intervene with a patient and help support them after they're discharged. But realistically, of course, we can't afford to make a phone call to every single patient we discharge from the ED. So we have to segment the population and align our outreach approach so that we can generate the highest impact for the most efficient cost. So some people will get text messages to check in on them, and higher risk patients may get a live phone call. But keep in mind that when you conduct outreach within 24 hours of an ED discharge, you're also pretty limited in terms of the data that we have available to us and the factors that you can use to really drive that outreach plan and make those segmentation decisions. You don't really know the final diagnosis code at that point. You don't really have a coded chart. You may not even know really sort of the patient's risk score at that point either. But what we do know is their demographic information, the typical level of access to follow-up care in that community that they would have available to them, and their past history with ED visits, which is actually very predictive for repeat ED visits. So we can use all that information to really segment our ED discharges every day for really efficient outreach campaigns.